Eastern.
Welcome, everyone. We will be broadcasting in just about 15 seconds. Bear with us. Okay, we're going to get started. I want to welcome everyone from around the world to another episode of our Global Cosmetic Surgery. And this time we'll be doing a hair talk session. I'm one of your hosts. My name is Dr. Tanuj Nakra. I'm in the United States. Dr. Deborah Shom is my other co-founder of Global Cosmetic Surgery. We've been pleased to have formed this platform in 2020 at the height of the pandemic, when we were all cut off from live meetings and unable to meet as we usually did before the pandemic. Global Cosmetic Surgery became an essential international platform during the pandemic for international collaboration, research, and education. And even in the post-pandemic learning environment, we've continued to grow and build our relationships with colleagues around the world by hosting virtual presentations just like this on a regular basis. And we look forward to actually increasing the cadence of our presentations to you. Virtual learning these days, even though we're now used to going back to in-person meetings, what we learned during the pandemic is these virtual meetings are convenient, oftentimes free, and they bring really true international icons into your own living room for your own educational purposes, which really makes us very happy because we're able to act as a resource to change patient care around the world. And so, again, we welcome you to another session of Global Cosmetic Surgery Hair Talks. Now, we have two general sessions that we host here in Global Cosmetic Surgery. We have our aesthetic talks, which have been going on since 2020, and Hair Talks is a newer episode that we're starting to feature, where we talk all about hair transplantation, hair regrowth, exosomes, all the topics of hair, which of course is a growing topic, interesting to practitioners and consumers around the world. And today, we're very excited to feature first Dr. Michael Gold, who has been a big supporter of Global Cosmetic Surgery since the inception. And he will be introducing our keynote speaker shortly, Dr. Jane Yu, who is an icon in dermatology based in New York City. And so before we dive into Hair Talks, I just wanted to let everyone know that we are also excited to announce that on September 8th, we will be featuring our next Aesthetic Talks by Global Cosmetic Surgery. And we'll be featuring world-renowned Dr. Guy Mastery from Los Angeles, and also Dr. Wendy Lee from Miami, who's the incoming president of the American Society of Ophthalmic Plastic Surgery. And the two of them will be giving keynote talks on facial aesthetic surgery and facial rejuvenation. We invite you to follow us at Global Cosmetic Surge on social media channels to keep up with updates on timings and registrations for this upcoming free educational event on September 8th, again, with two of the world's most renowned facial aesthetic oculoplastic surgeons, Dr. Guy Mastery and Wendy Lee, on September 8th. So without further ado, I'd like to bring Dr. Michael Gold onto the virtual stage. Dr. Gold is based in Nashville. He really, I keep using the word icon, but we are surrounded by icons today, and Michael Gold is one of them in dermatology. He has written over 300 peer-reviewed articles, 35 textbook chapters. He founded Gold Skincare Center in Nashville more than 2 decades ago, and he's grown to become an international leader in dermatology from an educational standpoint, from an organizational standpoint. He founded Dazzle. He founded the Five Continent Congress. Michael, we've been so pleased to have you as one of our supporters in Global Cosmetic Surgery. Thank you for joining us again today, and we look forward to hearing from you and your introduction of Dr. Jane Yu. Thank you, Michael.
Thank you. Thank you. It's my absolute pleasure to be with you all today. I want to first thank Tanuj and Debraj for organizing Global Cosmetic Surgery. As Tanuj said, the during the pandemic, we were all at a loss for educational events, how we're going to do this, how we were going to share knowledge across the globe. And the events that you all put on were just truly amazing, with faculty from all over, and the talks were just amazing, and we all learned, and it was just a way to see everybody, and that was such a great idea, and I'm so thrilled to be able to continue this. So they asked me to set up with their team a group of hair talks. We're going to do this, I hope, every month or every other month, depending on how we get it all organized, but we'll get everybody the information about it. But I think this is a wonderful concept. So I get the pleasure of introducing our keynote speaker. I also get the pleasure of hosting an amazing panel when we're finished. But I'm going to start with Dr. Jane Yu. I'm going to pump her up a little bit. When you read her and you go through her bio, it's like every parent's dream to have a student and a child like this. So I'm going to tell you really quick. So, Bachelor of Science from the Massachusetts Institute of Technology. She had also worked at graduate school at Harvard with the World Health Organization, medical school in Virginia, at Medical College of Virginia. Did all her training at Albert Einstein College of Medicine in New York. Loved skin cancer, so pursued a Mohs Fellowship at Yale. And she does a lot of clinical research. And as what I told people before we got on this, Jane and I spend a lot of time on the world of exosomes. She's one of the world's leading experts in everything there is about exosomes. So I thought it would be wonderful in this session where we talk about exosomes for hair to invite Jane to give her talk. So I'm going to be quiet now. I'm going to let Jane give her talk. And Jane, we are so thrilled to have you, and the stage is yours.
Thank you so much, Dr. Gold. Thank you so much to Global Cosmetic Surgery for inviting me. And I would say there's no true one expert. There are multiple experts all around the world, and we have so much knowledge and so much excitement in terms of like sharing all of our knowledge and brilliant ideas. So today I'm basically going to be giving you a brief overview on exosome therapy for hair regeneration. So bear with me because a lot of it will be the nitty-gritty into like hair, and we'll go over hair loss, and then we'll move from there on. Let's see if I can get my slides. They moving? Okay. I don't have any disclosures. This content of the presentation represents my personal views and insights as a dermatologist. Exosomes, as you know, have not been approved by the FDA for any specific therapeutic application. So this presentation is solely intended for informational and educational purposes. So the outline of my talk is going to be like this. We're going to go over hair loss, the different types. We're going to briefly speak about aging, metabolism, and stress. Regenerative medicine, what is it? Then go into regenerative medicine and hair loss, exosomes, who, what, and where, exosomes and hair, looking at the basic science and clinical potential. Finally, the regulatory hurdles and future directions. So when we think about alopecia, we think of it as being scarring or non-scarring. And I think that sometimes we have to really go back to the basics and the beginning to see like what are the causes of hair loss. When we look at scarring alopecia or cicatricial alopecia, these are only 5% of the alopecias, and they can be categorized as inflammatory, either neutrophilic, consisting of something like folliculitis T. calvins, lymphocytic, CCCA, or Graham-Little syndrome, or a mixed subtype, such as acne cheilitis. We have various treatments available, including topical intralesional corticosteroids, as well as antimalarials, immunosuppressants, and antimicrobials. But this type of hair loss is not the one we typically think about when we're trying to think about hair regeneration. So then we move to non-scarring alopecias. Non-scarring alopecias include AGA or androgenetic alopecia, alopecia areata, the anagen effluvium, the telogen effluvium, sometimes caused by stress, the trichotillomania when your patients are, pulling out their eyebrows as well as their eyelashes, lipidemia scalp, as well as traction alopecia. And traction alopecia is on a spectrum and may include scarring. Treatments are similar, including corticosteroids as well as minoxidil and the 5-alpha reductase inhibitors. So, androgenetic alopecia is the most common cause of hair loss among men and women. This is characterized by hair follicular miniaturization, and it has to do with the disruption in the growth cycle from DHT accumulation. So, you can see here that 5-alpha reductase in the diagram below inhibits the testosterone metabolism. And above, you can see the histology where the lymphocytes and mast cells are around the miniature's hair follicles and bulge area. So that actually causes a reduction in the number of the progenitor cells and the quantity of the hair follicular stem cells, leading to perifollicular inflammation and upregulating different genes encoding caspase-7 as well as TNF. In AGA, also to note, the hair follicular stem cells are normal, but there's a decreased pool of activity in the multiplying progenitor cells. So obviously the pathway is not in the number of hair follicular stem cells, but the regulator of these stem cells by activation or inhibition. Now, there are multiple theories of androgenetic alopecia. One of them has to do with the oxidative stress resulting from expression of the pro-inflammatory cytokines attributable to the perifollicular inflammation. So when you have this oxidative stress, it basically causes premature and dysfunctional dermal papillal cells. Secondly, you have high androgen levels as well as environmental factors that interrupt different hormone pathways and increase cortisone levels. And then finally, gene variants, which increase the activity of 5-alpha reductase and sensitivity of the androgen receptors. Now, alopecia areata affects sexes both equally. There can be different types, as you know, including alopecia totalis, universalis, as well as patchy alopecia areata. Patterns can be reticular, epiphysis, cystopho, and perinevoid. So the histology, as you see above, peribelvular lymphocytic infiltration comprising of a cluster of differentiated T cells in the follicular epithelium and around the hair follicles. In terms of the etiology, a lot of dysregulation of T helper cytokines, as well as Th2 cytokines, the regulatory T cells, and Th17 cytokines. And of note, the pharmacal inhibition of the JAK-STAT pathway enhances hair growth by basically disrupting the hair follicle stem cell quiescence. So that's the mechanism of action of how those medications work for alopecia areata. Now, aging, metabolism, and stress can also impact the hair follicular stem cell by causing quiescence as well as miniaturization of the hair shaft. So basically, when we have like age-related changes, the hair follicular stem cells become impaired. And so what happens is that you have hair follicle mineralization and the absence of the dermal papilla. And prior to this mineralization, the stem cells can undergo severe dysregulation, including some of the hair follicle stem cell markers and maintenance markers. So you have the terminal differentiation of the epidermis, as well as escape from the bulge during aging. So this is another diagram just explaining that process of how important the hair follicle stem cells are. They're found in the bulge region of the hair follicle. They include the epithelial as well as melanocytic stem cells, and they have the ability to migrate and proliferate and basically are like the homing mechanisms. So they can differentiate and move to form the inner root sheet in the shaft. And so during this process, they will remain in the bulge until they become dormant again. In terms of the regenerative space, we can characterize different classes of therapies. The first including exosomes, which are endogenous lipid nanoparticles that are found in every single bodily fluid and carry vast potential of information. So there's a number of things that they can do. They can repair damaged sites and inflammation, angiogenesis, anti-apoptosis, as well as anti-aging. The good thing is that they're non-immunogenic. we're all familiar with stem cells, which are living cells. However, these must be used and carefully preserved. They're found in certain tissues. They provide information, but they have limited therapeutic potential. And then PRP, which basically consists of plasma and platelets that have growth factors and cytokines, mostly have been used to treat hair loss as well as cell injury. So in terms of regenerative medicine strategies for hair loss, basically what we want to do is we want to replace cells as well as tissue and organs by stem cells, soluble trophic molecules, from stem cell or hematopoietic tissue-derived cytokines and growth factors, and also consider gene-based therapies. So the molecular mechanisms in regenerative medicine are not fully understood. However, it is theorized that for these classes, the stem cells will migrate into damaged tissue and differentiate, but practically we know they release trophic or paracrine factors. PRP exerts hemopoietic effects through the release of cytokines and growth factors. And then finally, exosomes predominantly work through paracrine signaling to exert their effects. I like this chart here because it basically divides it into stem cell rich as well as growth factor rich, properties. And so you can see on one side the adult stem cells as well as the perinatal stem cells, and then the growth factors include the PRP, the autologous growth factor concentrates, the conditioned medium or secretomes, and then finally the extracellular vesicles, which exosomes are a class of, and then placental extract. When we think about where exosomes are found, we basically have to look at different categories. So the first includes umbilical cord mesenchymal stem cells. This helps for skin rejuvenation and the human dermal fibroblast migration, as well as the upregulation of collagen. Secondly, we have adipose-derived stem cells, which help with cell proliferation and migration and decrease reoxygen oxidase species damage and DNA damage. Third, bone marrow-derived stem cells. They concentrate the national function of a stem cell and they're regenerative for skin. Human trophoblast stem cells, which have superior regenerative capabilities, lead to the proliferation and migration of the human dermal fibroblasts, increase collagen 1 as well as 3 and elastin, and decrease the MMPs and 1 and 3. And then finally, the plant-derived stem cells, which have regenerative capacity and promote cellular growth with protective effects and are exosome-like nanovesicles. And some people think that those are safer than the human-sourced. So what do exosomes contain? They contain several things. The first is the lipid bilayer and cellular differentiation markers. The second, microRNA, which is very important because this regulates gene expression, promotes the keratinocyte migration, and interacts with messenger RNA, which, as we know, is a key component of the Moderna COVID vaccine and is used in different forms of cancer research. There's also natural and synthetic varieties. Finally, the growth factors, which basically manage inflammation and regeneration and are used to enhance the wound healing process and provide signals from one cell to another. In terms of mechanism of action, you can think of it as basically targeting and repairing damaged tissues at sites of inflammation by transferring content, resulting in changes to the other cell. So you can see the exosomes are being released by the mesenchymal stem cell and then are affecting the recipient cell. So these exosomes which contain the growth factors, mRNA, the microRNA, lipids, as well as cell signaling proteins can lead to repair and regeneration of cells. Again, they are acellular, so they typically have a reliable and robust safety profile. Now, when we think about exosomes, I think we have to think about what are the contents and also what are we looking at in terms of our goals. Are we looking at scar removal, skin rejuvenation, pigmentation regulation, or, in this case, hair growth? So we know for hair growth, there are certain signaling pathways that are involved. And so we really have to figure out, what is the mRNA as well as the microRNA that is going to help us with hair rejuvenation? And in terms of hair, where can we get these sources? So the adult sources of mesenchymal stem cells include the adipose tissue, the bone marrow, as well as the hair follicles from the hair follicle stem cells and hair dermal papillal cells. There can also be perinatal sources such as the placenta and the fetal adnexa. So basically, again, just to reiterate, the MSC-derived exosomes are secreted through paracrine signaling, and they facilitate the cell-to-cell transformation. Okay, so you have different transcription factors, cytokines, and nucleic acids all playing a role in this. And so you can see, looking at the transition from the telogen to the anagen phase, you want these stem cells and the exosomes to interact to be able to facilitate this process. So how do we regenerate the hair follicles? Well, we know that the dermal papillal cells are very important. They are specialized fibroblasts, and they are a spheroid structure at the base of the hair follicle. So if we go back here, we can see where they are, okay? And then they're essential for the hair follicle morphogenesis and the hair cycling. And so these cells are very important in terms of being a paracrine regulator of hair follicle stem cells and the outer root stem cells. And here you can see the different paracrine factors as well as the activity on hair growth. So you have things like VEGF, PDGF, TGF-beta, BMP, Wnt3A, PGF2 alpha, and analogs. So these are the things that you kind of want to consider when looking at the hair pathway and making sure that whatever exosome product you're using has some of these paracrine factors that are helping to initiate hair growth. So just a word on the microRNA and some of the basic science studies that have been published. So we know that sequence analysis of the DPC exosomes identified basically 111 differentially expressed mRNAs. And so previous studies, in this one paper identified 2 that were positive, the MRR 181A5P and then the MIR 218-5P that were shown to induce hair growth in vitro as well as in vivo. So we know that these types of microRNAs can help with hair growth. Now, in terms of the therapeutic potential, we know that the exosomes derived from mesenchymal stem cells such as adipose-derived stem cells can increase the hair growth. And this is potentially through the paracrine regulation, again, of the dermal papillal cells as demonstrated in vitro. So the DPC exos, when they were purified by a 3-dimensional culture, and this was done experimentally, they induced a human hair follicle growth, and they facilitated that transition from the telogen to anagen phase in mice. And they did this through the upregulation of the FGF and the beta-catenin pathway. So if you go back here, again, we're looking at the different paracrine factors and the activity on the hair growth and making sure that that interaction goes through for hair growth. What about clinical evidence? Are there any clinical trials? Well, a recent PubMed search found maybe like 4 different trials that were going on. Most are not recruiting yet. One was completed. A lot of these have been occurring in the Middle East. So there's not much out there, but there's a lot of anecdotal evidence. And we know that there are a lot of companies that have come with their exosomes to basically let us know that, even though that there's not the clinical data, we do have a lot of anecdotal evidence to enable us to pursue this hair growth. What are some therapeutic strategies to enhance efficacy? Well, we know that the hair follicle bulge contains these stem cells. They reside 1 to 1.8 millimeters below the skin surface. So that's one thing that you need to consider when you are doing any sort of procedures. We also want to think about delivery systems to facilitate the drug penetration, enhance the pharmacokinetics. That's why microneedling or laser resurfacing, and obviously sub-Q injection, which is not allowed in the United States, but in other countries is a consideration. Finally, some people also use low-frequency ultrasound devices to enhance skin permeability at different scalp locations. So there are a number of regulatory hurdles as well as technical difficulties. In the United States, the FDA regulations limit it to cosmetic use, and there's no ability to inject, although that is off-label, and some people do inject. There are different technical challenges, such as methods of isolation, as well as characterization, the large-scale production, and the limited detection of the exosome content associated with the hair growth. So I would say, what exactly are we delivering to the scalp? Um, Also, we know that since it's a cell-free therapeutic product, this can decrease the risk of tumor genesis compared to, say, stem cell therapy. But there have been severe infections, especially in 2019, due to substandard manufacturing conditions. So I really want to emphasize that adherence to GMP or good manufacturing practice is paramount for minimizing the risk of contamination and microbes, including mycoplasma, because this can trigger a host immune response, and people can also get sepsis. So let's look at future directions. It's really bright. The global regenerative market is going to reach 531.7 billion by 2033. Just this past year, it was valued at 32.1 billion, and it's growing. The CAGR is about 32.4 over the forecasted period. So we know that a lot of the technological advancements, will provide a lot of different opportunities in the future. These are my references, and thank you so much for letting me participate in this fun interactive session.
Thank you so much. That was absolutely incredible. And I was so happy to see all the science behind the hair stuff, right? Because
Yeah.
in our world of dermatology, we spend a lot of time on the science of all this, and we want to make sure we share that with all our colleagues all the time, because it's not just as simple as, okay, take a vial of something and here it is and whatever. There's a rationale how these things have been developed and how we use them and so forth. So that was great. I really thank you, and I hope you'll stick around as we get into our panel discussion with everybody. So what we're going to do now is we're going to shift to what we call our panel discussion for the next 30 minutes or so, 20 minutes, 30 minutes. And we're thrilled. I'm going to mess up everybody's name, but I promise I won't. I'll do my best. Dr. Anku Sharan, you're from Malaysia. We have Vivek Singhal and Dr. Krishna and Dr. Sarangi joining us, as well as Dr. Nakwa. So we have a great group of panelists that are experts in hair and experts in their fields, global experts. And what I really want to do is have everybody share their experiences with exosomes, the good, the bad, the indifferent, and how they use them, what they see the challenges are, and so forth. So I'm actually going to start with my little prep thing that no slides, but I just want to give my little anecdotes here. So we are all using exosomes, and we're using more and more of these products. And as Jane mentioned, in the US, we are absolutely limited to topical application. And as Jane said, in order to grow hair, we've got to get this down to the hair bulge. And if we don't get it to into the bulge, we're not going to see that much of a response. And topically, that becomes really hard. So most of us will use a procedure of some kind to open channels, to deliver the exosomes into it, which is, again, cosmetic uses, and it's okay. But the FDA has really come down on companies that promote injecting exosomes. There have been warning letters over the last 7 years. There have been several companies who have gotten several warning letters about off-label, about promoting this, because these are not drugs. And if they want to go through the drug pathway, and some are, they have to file what's called an IND with the FDA. They have to spend, this is millions and millions of US dollar projects to get these studies done. They have to be done with an institutional review board. And again, we're allowed to do a lot of things off label in the United States, but exosomes, in my opinion, in the US should not be injected. And I preach that every lecture that I give on exosomes, and most people also do the same. Outside the US, I know in Europe, human-based products are not allowed. And that may be in certain of your countries, but you need to check. And if it's a human-based exosomes in, let's say, in anywhere in the EU, you cannot inject. So that's given the rise to these plant-based exosomes. So at the beginning, when plant-based exosomes came to the US, most of us said, that's really not going to work and not do anything. But I think with the clinical work that's been done and shown, these actually can be beneficial in many instances. So, we've got to be careful. We've got to understand the country where you practice, where you are, what the regulations are, so that we do things correctly. And then, then you're all set. But I think the science is there, and Jane eloquently showed that kind of work and how we can use these products to enhance hair growth. And I think for me, that's really important. So that's enough for me. So we'll go down. I think the best thing for me is just to go down my list. So I'm going to ask everybody to introduce themselves. Where are you from? What kind of practice you have, and what your experiences are with exosomes. So, Dr. Sharon, would you like to start, please?
Hi, Dr. Gold. Thank you very much for the kind introduction. Well, I'm from Malaysia, as what mentioned by Dr. Gold. Actually, in my, a little bit about myself. I'm also lucky to be the president of registered medical aesthetic practitioners in Malaysia for the past 6 years. And I guess in our organization, what we do, among others, is to connect or to liaise with the Ministry of Health of Malaysia to give them or to feed them with the latest information and advancement in aesthetic and also in regenerative medicine. Among others, Exosome. And initially, we started with PRP when we had to show a lot of papers, literatures. Unfortunately, I don't know about other countries, but unfortunately, in Malaysia also, PRP is still not considered to be a treatment, and is this put as a status quo. They didn't say that we can't use it, but well, off-label usage is permissible, but at their own risk. Similarly, with Exosome, after stem cell was there in the market, then people start to talk about Exosome, and legally, actually, in our country, we are not allowed to inject Exosome to human as a treatment. I think this goes similar in US and probably many other countries in the world. And also, among others, actually, in terms of the efficacy, in terms of the dosage that we need to use on different indication or for even different patient. That's one of the concern that was brought up by the Ministry of Health here in Malaysia. So, but anyway, somehow I saw suppliers still selling this to all the doctors here in Malaysia. And normally, Exosome here in Malaysia, we use it. Initially, we started with for facial usage, rejuvenation. And because of I think it's more on hearsay, more on testimonial effect or anecdotal, like what Dr. Jane was saying just now. Doctors, not only patient, buy into that ideas. So they start injecting it intradermally to patients. Some says that it works, some say it doesn't work, but all of this treatment at that time even until now, are considered to be illegal, or what we call here underground treatment in Malaysia. So it is not recognized, but for the past half a year or more, I mean, it's relatively new in Malaysia. Exosome for hair is considered to be something that they start to use it on patient. And I might say, based on my experience, we do have, in my practice, I do have a supplier from a lab who produce Exosome. And they have different category, you know, some of them are quite, the price is very low, and the others are selling at a very premium price. According to them, probably one of them is, they claim that is from GMP manufacturer, which maybe is true, but in terms of result, is quite, how to put it, it's not really based on testimonial again, and some say it's good, some say it doesn't work at all. And when it comes to hair, using a plant-based is something new, relatively new in Malaysia. We've been using it for the past 4 months to 5 months. I wouldn't say the result is not there, but it still probably takes some time for us doctors here in Malaysia to see a good outcome of that. But when we check, when we do registration in our country, we got no restriction, but it can be only used for topical usage. Nothing on injection for the time we tried, but they rejected our application for that matter. I think that's, I guess, what I can share for now.
Perfect. Thank you. So I messed up the program a little bit, but that's okay. After our panel, we're going to have Dr. Kumar give a talk on, it's a sponsored talk from QR678. That'll come up when we're done the panel. So bear with us. My bad. Dr. Singhal, you want to give your experience with exosomes where you are? Tell us where you are and all that. There you are.
Yeah.
You're on. We hear you. Go ahead.
All right. So I'm Dr. Vivek Singhal. I'm a consultant dermatologist. I'm based in Kuwait, Middle East. So as Dr. Jain was speaking about the exosome, the quality and the specifications of exosomes are much more important. And there are a variety of exosomes which are available in the market. So we do not know which one is actually the best one and which is going to actually work. There is no standardization still here. So the experience with us is quite limited, and we are still experimenting with the different type of exosomes. So we are primarily using the PRP and the autologous microcell cluster therapy, which is the Regeneration, which is being used for hair growth. Exosomes are relatively a new thing. So we are still trying to figure out what is the best. And as Dr. Jain was saying, similar to the US, the human-derived stem cells or the exosomes are still not approved for use in our clinical practice. So that's it from me in Kuwait, and that's a roundup for the Middle East.
Thank you so much. And yeah, I think being somebody who spends a lot of time traveling and going to meetings, when you do go to some of the big meetings in the Middle East, there are hundreds and hundreds and hundreds of exosome companies out there that are displaying and showing their things at those meetings. You know, and again, trying to figure out what's real and what's not real is the key when you deal with all that. All right, thank you, Dr.
Exactly, agree with this.
Yeah, Dr. Krishna, you're next. Do we have Dr. Krishna?
No, he's dropped out because of some technical reasons. We should move on to the next panelist.
All right, so Dr. Sarangi, you are up next. Give us your experience.
Hi, good evening, everybody. In fact, today I'm more of a learner, a student, rather than a panelist, because this is an evolving subject and a gray subject still. We don't know much about it. We are still groping around to find out what is right, what is wrong. I have been using it for almost 5 years. Like Dr. Gold said, when we travel, we try to pick up products and try it ourselves. And still, there are a lot of questions in our mind, but this previous lecture by Dr. It was very informative. So I've been using growth factor concentrate for the hair growth for almost like 6 years or more. Before that, I was doing PRP. And now I've started this plant-based exosomes for the last 3 years, I think. And so vis-a-vis, if I compare, I am finding very good result, though I punctuate it with growth factor concentrate and the plant-based exosomes. And the advantage is that it is less painful. Results are pretty good, but we cannot use it on very advanced type of alopecia. Like I use it mostly on telogen effluvium or on male pattern alopecia. But that in the initial stages, very, very good results. And I normally, in the initial stages of alopecia, I give them only this exosomes, the plant-based ones. And in an advanced stage, I combine it with, like I told you, with growth factor concentrate, with very good, very encouraging results. And so I delay the hair transplant, or rather some of my patients, like almost like 60% of my patients are not going for hair transplant now. And I would like to know more about this. And I've started using human-based exosomes recently.
Dr. Kalpana, have you do you know the specific growth factors that you are using?
Yeah,
and
yeah.
also, do you also what's your treatment timeline in terms of how frequently you're doing it?
I'm doing it once a month. And they are all this the platelet-derived growth factor, endothelial growth factor, then tumor necrosis growth factor. There are 7 to 8 of the growth factors in that the sample which I use. And once a month I use that, and I punctuate this after 2 weeks of the human-derived growth factor. I use this plant-based growth factor. That is the protocol I've been using with good result.
Great, thank you.
Yeah.
All right, and then we'll go on to Dr. Yudi Nakwa to give comments on how they're used in his clinic.
Can you hear me?
Yes.
Yep.
So,
Go ahead.
Yeah, okay.
We can hear you.
All right. So this is Dr. Yuti Nakwa. I'm practicing in Mumbai. And first I would like to thank Dr. Jain because it was an excellent presentation. And we have such less material known to us regarding, exosomes. So in my practice, I've been primarily using the platelet-rich plasma, growth factor concentrate, and I've been using a lot of biomimetic peptides recently since last 2-3 years of my practice. And actually, these biomimetic peptides have really helped me to move from PRP and use it more for patients with, initial grades of alopecia, intermediate grades of alopecia. Of course, they are less painful than PRP, and the results that I do see are much faster and better as compared to PRP. So in my practice, primarily, I use biomimetic peptides along with PRP and growth factor concentrate in combination.
Great, thank you. All right, so I thank my panelists. Stick around because we got to have some more questions and things coming. I do want to make a comment. There is a published paper out there in the Journal of Cosmetic Dermatology about taking somebody with white or gray hair, and I'm almost, if I remember correctly, injecting exosomes in that area, and the hair has turned dark. And so I know there are some companies out there doing some more clinical research on this aspect of using exosomes for taking white and gray hair and seeing what we can do with all this. I think that's a fascinating concept. If we can take somebody with gray hair like me and make it dark again, this is the holy grail, in my opinion, for hair rejuvenation. All right, so now I'm going to go back to our sponsored talk. I'm sorry, I skipped that at the beginning. Dr. Vaibhav Kumar, I probably did not say that right. He is the senior manager of the medical team at QR678, our hosts for this evening. He is pursuing a PhD from Maastricht University, has spent over 8 years in the clinical research. He's a public health professional and research analyst, published over 50 papers. We are thrilled to have Dr. Kumar with us. So, Dr. Kumar, you have the floor.
A very good day to one and all. On behalf of Team QR678, it's my proud privilege and honor to welcome you all once again to the GCS HairTalks event. QR678 and the entire team is extremely proud to partner once again with the same. Myself, Dr. Vaibhav Kumar, I would be presenting the yin and yang of the exosome therapy. It's been beautifully summed up by Dr. JNU, and let's dive into the challenges and opportunities for the same and take a quick run through about the new era or the new forthcoming ventures that may be in the offing. Now, for those who are unaware, the QR678 Neo is a revolutionary, patented, evidence-based, biomimetic, peptide-driven anti-hair loss and hair regrowth therapy. It stands at the pedestals of being researched, recognized, as well as revolutionary. It's a novel invention that overcomes the barriers, challenges, and uncertainties and proves to be a first-in-class hair regrowth product and a revolutionary procedure for the management of alopecia. It has a dual patent in India as well as the USA, and it has a global presence with regulatory approval in 10+ countries with a CE certification in the European Union as well. So the evidence in the QR678, which consists of biomimetic polypeptides, which are analogous to growth factors, is immense. It has 13 clinical papers which are published in top international PubMed or Medline Index journals. And very important to note is that these publications explore all the facets of alopecia. It's a minimally invasive therapy with no side effects and zero downtime whatsoever. These are the snapshots of the research studies. Has been the animal trial, the human trial, the trials against hair loss due to PCOS, the hair loss due to various other etiologies such as chemotherapy-induced alopecia, difficult to treat cases such as alopecia areata, and so on and so forth. It has a proven mechanism of action which acts from the root to the tip. It acts on all aspects of the hair growth cycle and the hair architecture. It consists of these stimulatory sustained biomimetic polypeptides which mimic these growth factors, which stimulates angiogenesis, helps in dermal fibroblast mitogen, inhibits the apoptosis, has copper tripeptide which inhibits the 5-alpha reductase, also ingredients which go and increase hair follicle survival and stimulates the stem cells. So hence, the QR678 is the spark to save the follicle. It stimulates the growth factors. It protects from DHT and inflammation. It has anagen phase activation. It rejuvenates the hair follicles. And it has key factors in stimulating these dormant follicles as well. Now, as we've seen, animal-derived exosomes have warning signs against them. The current evidence suggests that there is limited or paucity of clinical data. There are various reported side effects of the same as well. And very importantly, the FDA has regulatory concerns pinned up against animal-derived exosomes. Of course, there are risk of contaminations and infections which are associated with this therapy as well. The carcinogenic potential has been recorded in which is associated with the animal-derived exosomes, leading to the risks and concerns about using the same. It has an unknown mechanism of action. There's a greater risk of contamination, and there's a higher likelihood of triggering an unwanted immunogenic response, which leads to potentially adverse side effects. So much so that the FDA has put a public safety notification on the exosomes, stating that it violates the nature of stem cell products on their website and is then hence having unsubstantial claims in treating these various conditions. So moving on to greener pastures, the plant exosomes is an opportunity where it is a more safer and more ethical alternative. It has lower immunogenicity and of course less risk of contamination that has been reported. So on one side, where we have the exosomes, which deliver bioactive molecules and stimulate the hair follicle regeneration, we have the growth factors or peptides, as we saw, which has proteins which stimulate the cell growth. They promote hair follicle activity, enhance the blood supply to the scalp, and prolong the hair growth phase. So the synergistic opportunity in marrying or coupling these two particular therapies is the new era or the new vista in the offing. So the three-pronged synergistic combination of the plant-derived exosomes with the biomimetic polypeptides or the QR678 related composition would be proving where the plant exosomes directly signal to target the cells better. They ensure that the growth factors reach the intended site of the action effectively and efficiently, and they also prolong the therapeutic effect of these biomimetic peptides or the growth factor combination. So hence, a combination of promoting plus signaling would lead to a predictable and sustained hair regrowth combination. Whereas the growth factors of the biomimetic polypeptides would be contributing as promoting molecules, we helped with the signaling factors present in the plant-derived exosomes, leading to a new sustained product, which may be extremely, extremely beneficial for creating all the gaps which are currently present in literature. So the intercellular communication would be derived and help with the help of exosomes, which carry these small vesicles laced with molecules such as peptides, proteins, lipids, and RNA. And when these are combined with the growth factors, the exosomes can better direct these signals to the target cells. The exosomes can also serve as a carrier for growth factors, improving the delivery to the hair follicles, hence ensuring that these growth factors or peptides reach the intended site more effectively. And also the exosomes can enhance the bioavailability of these growth factors or peptides, ensuring for a more prolonged therapeutic effect as well. So well, we know one thing's for sure. While exosomes primarily work by promoting cellular communication and activating stem cells, the growth factors directly stimulate hair follicle activity and proliferation. Hence, the coupling of the plant-derived exosomes with the QR678-like biomimetic polypeptide solution would be a new era or vista in the offering and a new product extension for us to combat and address multiple angles of hair loss, such as enhancing hair follicle stem cell function, reducing the inflammation, promoting the vascularization, and increasing hair follicle size and number, both qualitatively and quantitatively. So with this, I thank you all for a very patient hearing. I thank all the attendees, respected Dr. Jane Yu, and all the other panelists, and all of you all who have tuned in on a Sunday to attend the HairTalks, and looking forwards to a greater and more fruitful deliberations in the future months to come.
That was great. Thanks. So, all right. So now I'm going to open up to questions. And I have a bunch of questions that have come through to me. And I would like Dr. Hu and all the panelists that are here to answer them. Some we'll try not to repeat any. But the first question, and I'm going to start with Jane. What's the differences between botanical and human exosomes? Why not botanical over human? And so, you know, I think we've talked about it, but can you summarize it real quick?
Yeah, I would say that, you know, again, there's when people think about plant exosomes, plants aren't really humans, right? So when you're thinking about different cell functions and you want to mimic those functions with different growth factors, it's not as though all the plant-derived growth factors can act in the same way. I think safety is probably the number one reason why people try to use the plant exosomes, but I think the efficacy, until we see all the clinical data, I think the efficacy is not as great as the mesenchymal stem cell exosomes.
Yeah, I agree. Do you want to comment on the carcinoma potential that we just heard about? And I think we've debunked that pretty much in the
Yeah,
exosome space.
it's pretty low, and even the side effects. I'll put in a plug for dermatologic reviews that we both co-authored, co-edited. So we have an issue coming out just on exosomes and looking at the regulatory functions as well as some of the adverse effects. I think predominantly it comes from the GMP and the manufacturing, and not necessarily risks that are being caused from any sort of contamination with any viruses or bacteria.
Yeah. Yudi, Unga, any comments? You're good. All right. So there's another question, and I think again we covered some of this about regulations in your country and how do clinicians face regarding compliance and safety protocols. Ungo, you want to go through really quick again how you have dealt with the use of exosomes in Malaysia from a regulatory point of view? Unmute yourself. You're muted.
Thank you. Well, in Malaysia, as I mentioned before, we are also the safety of the public or the patient is the utmost important. And similarly, when it comes to stem cell or exosome for this matter, they are quite strict in the usage or the applicable application of these products. And plant-based is something new that we just arrived here in Malaysia. But I guess what we gather from the Malaysian Ministry of Health, their concern is that apart from safety, in order for us to get that safety component in certain product, of course, like any other countries, we need to go through phases before we can get it licensed here. And also the dosage, how you determine, to give one person certain dosage or quantity of that exosome, regardless whether it comes from regardless whether it comes from stem cell or even from plant-based. But currently, what I'm seeing here in Malaysia, most of the doctors are injecting, when we're talking about regardless whether it's MSC, exosome, or even plant-based, they are injecting it intradermally. Seldom I see they are using, LLT, laser light therapy, or even microneedling for that matter. But again, until this is my opinion, until we can determine or any research has been done to determine to quantify the amount for certain indication, then only probably we could see a good progress or a good application with upholding the patient safety as our number one importance.
Yeah, I mean, I think that's the key, right? No matter where you are, you need to check with your regulatory authorities. Can you use human, or do you have to use plant-based? Can you inject or not inject, according to the regulatory authorities? And just don't stray into unmuddied waters, right? It's there's enough charlatans out there that do crazy things, and we want to be very science-based. So there's a question here about how effective is this when combined with other hair treatments, regrowth treatments like needling, laser therapy or other topicals. That's, this is what we do, right? We have to deliver the exosomes in, and so we use all those modalities. I'm actually working now in the US, and when I come to India next weekend, I'm going to show this. It's the first FDA-approved fractional laser for hair regrowth, but I think using the exosomes after it is the only way to get a really nice benefit. That's how we're using it. So we'll see how that was. Is Dr. Kumar still, or Dr. Singhal, are you still on the line? If so, I have a question that I'd like to ask you, but
yeah, Dr. Singhal's on.
Okay, and Dr. Udi, do you have a lot of experience with QR678? So QR678, just so everybody knows, or Deborah, you can talk. QR678 is not in the US. I love the concept of these peptides and what the concept is, but obviously we can't inject them here, and so the getting them into the US and even on a topical thing is not very easy. And I know we've been working hard to get it here. So Dr. Yu and I can start playing with it. So, but I mean, the question is we don't have the studies to compare, right? One versus the, is PRP better than, you guys have done that work in India, but exosomes versus QR678, I don't think there's any comparable studies out there yet. Any comments on that? But we know it works.
It's too early. Exosomes are too early in India. So we've not done any comparative study. It's too, I would say probably after a year or so, we'll be in a better position to answer this question. But yeah, I have had very good result with QR678, no doubt about it. And in fact, like my, like the growth factor concentrate, which I was using, that has come down with QR678 because see, it is less painful and it's faster. And I add a little bit of that 650 nanometer red light therapy before I do the QR678 to enhance the result. So that's it. This is a journey. Let's see what we'll come up with as comparison with the exosomes.
Yeah, I mean, it would be at some point, right, to be able to do a clinical study where QR678 alone, QR678 and some sort of exosome, and to see if there's there may or may not be a beneficial effect, but it seems like it would be.
It would make sense to have like a synergistic effect, I would imagine.
Yeah, and these peptides are incredible, so it should work better. I mean, combination therapy is something that everybody on the panel promotes all the time. So if we can add something to that, I think that's really
right. Can I answer?
Sure.
So I've been using QR678 since last 2 years, and before 2 years, I was heavily using PRP and GFC in my practice. With PRP and GFC, what I used to notice that the result used to be quite slow, difficult for even the patients to appreciate, even after 5 to 6 sessions or 5 to 6 months of therapy. Only the clinical pictures would show them the results. 2 years back, I started using QR678, especially on all those patients whom I have been doing PRP. And we moved on to QR, and most of my patients were very happy with the results that they got. It was much faster, and they could see much more density, and we had clinical pictures to compare. And that's why I started doing more of QR in my practice, because these were the patients for whom I used to do PRP for years, and there was some kind of stagnation that we were seeing, and we were not really seeing much of a difference. And with this biomimetic peptides, actually, my patients could appreciate the result much better.
Good. Well,
Do you have them on concurrently?
Very interesting observation I've seen. I have started doing QR on my the 3 patients post-cancer after taking permission from their treating physician and the surgeon. I've tried it. I've tried on the eyebrows and I've tried it on the scalp. 3 ladies who are survivors breast cancer, and they have got very good, very interesting. One of them is 66-year-old, and one of them is 55, and the other one is in mid 60s. So they have done pretty well, and eyebrows has also responded very well. They had lost most of the hair, and after 3 sittings with QR, they have done very well.
Also, we
Yeah,
do get a lot
are
of.
you injecting QR?
I inject.
Yeah,
So even I inject
Yeah.
with 32 gauge needle.
Uh-huh.
Are you using minoxidil as well?
So yeah, in patients who are who would like to use, in India, we get a lot of patients who are not okay with taking finasteride or using minoxidil also. And I have been using QR in all those patients who are reluctant to use even minoxidil, and
And
with
you
good
and you
with
have
good
you also
response.
have a minoxidil finasteride topical readily
Yes.
available. It's a lot harder to get here.
Yeah.
We have some compounding pharmacies, but the last time I was in India, I brought home a whole bunch. So all right. So the next
So,
question that go ahead.
Gold,
I'd like to ask a question to Dr. Gold and
Sure.
Dr. Yu, actually. You know, I think that, you know, because you are both, you know, leaders in the field, you have, I would say, a longitudinal viewpoint and perspective on the technologies of hair growth. You know, I know Dr. Yu's mid-career, Dr. Gold, if I may so say, that you're kind of an elder statesman in the field. So you've been around since
I'm old. You could
before.
just say I'm old.
So you've been around watching this entire arc of, you know, the newer approaches to hair management, you know, from the 90s onward. So if you look into the crystal ball over the next few years, the two of you, I'd love to hear from both of you, and then we can go back to additional questions. But I think one question that I think everyone would enjoy learning from you both is, where do you see things headed? You know, this is a fast-moving field. You know, look into the future, give a prediction of 2-3 years from now, and then 10 years from now. You know, where will we be in the technology of hair regrowth?
Jane, you want to go first or you want me?
Sure. I think the micro RNAs are going to be really important, and I think that when we find different vehicles and carriers and have selected uptake, that's really going to be where the money is in terms of the hair restoration. We have a lot of non-specific things that are working right now, and we're just kind of like spraying them and sprinkling them on. But we really have to get down to the nitty-gritty and understand the mechanisms and pathways. And a lot of them are convoluted. So it's not just the JAK pathway or like the STAT pathway. There's a lot of things that interact with one another. And then 10 years from now, personalized medicine, baby. Because you know, as long as we're getting all of our genes tested and finding out the signatures that are specific to each individual, we'll be able to hone in on different treatments.
Yeah, I think Jane's got it right on. In 10 years, it'll be you take a blood sample, be able to figure out something, and you know, treat with your own whatever. Specifically, you know, picking the targets that you're looking to target that are absent or low level or whatever. I think that you know, we have, as Jane said as well, we're just in the infancy of what we can do with all these pathways and what we can learn. So as a dermatologist, you know, those of us that remember the days when I was a resident, I used to have to put patients with psoriasis in the hospital for 2 to 3 or 4 weeks just to give them their tar baths and tar treatments and things like that. And you know, it's mesmerizing now to see people that I saw 20, 25 years ago, and just hated their psoriatic disease treatments. They're clear, right? Every one of the new drugs that, you know, I call them the TV medicines here in the United States. Every other TV commercial here is about another psoriasis drug or atopic dermatitis drug. I mean, I have babies on atopic dermatitis, you know, drugs now that they're fine and they were miserable. And psoriatic patients are totally clear. Now we're looking into hidradenitis and vitiligo and alopecia areata, with medicines that I never dreamed could ever exist. And now even in my hidradenitis patients that we have we have 2 FDA approvals. We have 4 or 5 more that are in research protocols right now. But actually, one of the coolest things is taking our hidradenitis drugs, combining them with the semaglutides, because a lot of those people are obese, and we're seeing faster results even. And there's no approvals for that, but that's how a lot of us are thinking now. And so, I think in 10 years, we're going to be able to just sort of push buttons on a computer and figure out what these people need.
That's fantastic.
So I think we're in a great space. And I think, having leading experts in hair be able to discuss how we get there and so forth. And then again, I'm going to put a plug in for QR for a minute. I have reviewed a bunch of their papers over the years. Those that are in the Journal of Cosmetic Dermatology, I don't have I cannot accept a paper right as is. It has to go through the peer review process. If it's somebody I know, like this group, I actually have to recuse myself. So it goes through a really, tough process to get published. And so, we need companies to publish, whether it's a biomimetic peptide, whether it's, all these exosome companies that are out there. Again, I tell people all the time, when people say they have the best exosomes, the purest exosomes, the most number of exosomes, I don't really care. I just want to know that they've had some sort of publication, or they're actually doing some sort of clinical research to show that they actually do something. And without that, I'm not interested. So I think that it's really important to make sure that when you are approached by exosome companies or biomimetic peptide companies, that you actually ask them, show me the clinical research, not that you did in your lab, that somebody outside of the practice of their company has done. There are enough of us around the world that do these things, and that's key to what we need to have in all of what we do. So I think it's really important, and I think we'll learn more and more about exosomes as we move forward, and that's how we do this stuff. So those are the major questions, just so everybody
Dr.
knows.
Goel, I would want to step in and kind of rather thank you for setting the tone regarding the importance of evidence and the evidence-based science and evidence-based literature which backs these products or these research and evidence from bench to where we are using them commercially as well, sir.
Yeah, I mean, it's one thing to say that they work, right? And it's another thing for a company to say, and again, I get the cost involved in doing the research, but that cost comes back to you 10-fold, 100-fold if you do it and it does what you think it's going to do, and you set the tone for the whole industry. So I think that's important. And Dr. Vivek, you're back, right? Do you want to comment about QR in Kuwait real quick before we wrap up?
Yes, for sure. Because I have been doing of late a lot of autologous microcell cluster therapy, in which we take a piece of the skin and we extract the fat-derived stem cells and combine it with QR678, and the results have been fantastic. So I used to use a lot of PRP, and I had used QR over the last 10 years. And as Dr. Kalpana had mentioned, I have a bunch of patients who have used it in post-chemotherapy, and the results were excellent. So, but of late for androgenetic alopecia, the autologous microcell cluster is the upcoming therapy. And it's, as you mentioned, everything will come from our own body. Our body has everything. We just need to figure out what to fix where. And that's the key to the futuristic therapies. And that's what we are looking forward to.
Yeah, and again, I'll challenge everyone, if you're a QR, but every other company, if you're listening, I mean, I think that's a great study, is to look at post-cancer patient hair loss and, do a controlled study with a placebo or whatever, and at the end of the study, make sure the patients that are on placebo get the active ingredient. And you don't have, it's something that I'm sure, IRBs will approve, just so it's done correctly. I think, again, the more science that we can get out there, the better. And I think that's important. So those are the questions that we have. Tanuj, I'm going to thank Dr. Yu. I'm going to thank the entire panel, great group of docs to help us today. And I want to thank Debraj, Tanuj, and QR for sponsoring this, and Global Cosmetic Surgery. And then we do have more hair talks that we're going to get organized and on the books over the next couple weeks, so that we can keep this series going on a regular basis. So again, I'm going to turn it back to Tanuj for you to wrap it up.
I have one question.
Oh, sure, please.
One is to Dr. J, and it was wonderful presentation and very informative. So I want to know, my first question is, which is more efficacious, the exosomes from the amniotic fluid or from the placental blood? Number one. Number two is, we are all scared when you're using exosomes, we're scared about the teratogenicity. So as compared to the plant-based exosomes and the human-based exosomes, which is safer?
I think you have to question what you're looking at in terms of, are you looking at hair growth? Or are you looking
I'm talking about
like
hair.
skin rejuvenation? Again, looking at those specific paracrine signaling factors, I would start there and see, we know that the dermal papillal cells have to affect the hair follicular stem cells, and they have to activate and trigger them because they're in the quiescent mode during aging of the hair follicle, as well as androgenetic alopecia, and even during other types of alopecia. So you really have to look at mechanism and see what growth factors and what other miRNAs are involved. I don't think you can blanketly say that it's going to be like one type of mesenchymal stem cell versus another, because there's also varying degrees of the number of growth factors in those pathways. And then just to go back, know your GMP manufacturing processes. And, if you really know the exosome companies and trust them, then you'll be fine. Otherwise, you're going to be stuck in a hard place. Know the regulations that are in your country. In the United States, we can't inject. So we do all sorts of other things. I have fractional lasers in my office, do microneedling. We do all sorts of things to get better penetration, low-level light, ultrasound, so different mechanisms until we have the rigor and the scientific data to show that we can do other things with these products.
And safety-wise? Safety-wise, can you tell me?
Again, going back to the GMP processing, right? Because that's where you run into trouble. Because in 2019, there were those companies that, again, had a lot of contamination. And so you need to, as you're, ramping up the manufacturing and the production, you have to make sure all those safety measures are in place.
And if they're in place, you can really, the teratogenicity is really, in our space, is really negligent.
So I would like to add to some insight as well. This because I'll also use this platform to share with the group that we are currently in the advanced stages of research and development and clinical trials of a novel formulation which combines these peptides and these plant-derived exosomes in a particular standardized concentration. Now, when we were in this entire sojourn of finding this proof of concept, we understood that currently all these plant-derived derived exosomes may be working, may not be working, of course, but in India, they still have no regulatory approval as well. So, so that's one very important thing. So we are currently in this entire process of marrying clinical data along with regulatory expertise to get something very, very promising for all of us to use and introduce us into our in the practices.
It's not
That'll be
easy,
great.
so I commend you, Dr. Kumar. Thank you.
Yeah, that's a
So,
lot of work.
all right.
Yeah.
So I'm going to turn it back to Tanuj now.
Thank you, Dr. Gold. Well, once again, on behalf of the probably 1,000 people that are watching this Hair Talks, Dr. Yu, your presentation was really wonderful. It was both, I would say, far-reaching in explaining a lot of the details behind exosome and hair loss, and also dove into the details. So it really kind of covered both the breadth and the depth. So thank you for doing that talk. Michael, as always, your insights and expertise are fantastic. It's always a pleasure to have you as a part of our panel. Thank you for being the chief moderator. And then also just wanted to thank Dr. Krishna, Dr. Sarangi, Dr. Sharan, Dr. Singhal, Dr. Nakwa, and Dr. Kumar, who are all a very valuable part of this panel. This is obviously a very fun conversation to have. We look forward to doing this on a regular basis, and we'll be, as I mentioned in the beginning, also reinitiating our aesthetic surgery series again. So we'll be kind of taking these two fronts into the future with these regularly scheduled talks. And so again, want to encourage everyone just to follow Global Cosmetic Surge on social media so you can kind of keep track of these upcoming free webinars. Thank you again to all the panelists. Wishing you all a wonderful week ahead. And that's all for now. We'd like to sign off and wish you the best, and looking forward to seeing you again soon.
Thanks, everybody.
Thank you.
Thank you.
Lovely being here. Thank you so
Thank you.
much. Bye-bye.
Thank you.